Hello everyone. So I'm Karen Spooner, the Community Development Manager on the Smartline project, and I'm going to chat to you a little bit about how we've worked with the community over the last few years and how they've supported our research and development. So from the outset, we really wanted to get to know our community, which at the time was around 300 households based in the Camborne, Poole, Iluggan and Redruth areas. We know that Cornwall faces a high percentage of social and digital exclusion, and as a result of this, face poorer outcomes. How could we begin to tackle this as a team and understand the potential impact of this with our customers? And what were their biggest concerns and how could we support them? We were able to meet people from many backgrounds, from many walks of life, living in many different types of communities and in many different types of property. We wanted to understand how they felt about their immediate communities, the wider areas in which they lived, their own homes, and their personal health and well-being. But how did we do this? We developed our guided conversation tool, which is now known as the Smartline Guided Conversation. This was inspired by the Warwick and Edinburgh Mental Wellbeing Scale, which has been widely used nationally and internationally for monitoring, evaluating projects and programmes and investigating the determinants of mental wellbeing. Our customers were able to score themselves on a variety of open-ended statements, and then we explored those scores further if customers wanted to. For those who did want to explore further, we were very often able to support further in terms of signposting, referral or information and advice, otherwise known as social prescription. Where we saw themes amongst groups of people in communities, we were able to start developing community projects. We supported people who were existing within places to come together, a lot of the time as individuals, to form groups and friendships that became meaningful. The community projects created were wide and varied and very much led by the customers who wanted to see them come into fruition. Coffee mornings, exercise classes, green space developments, a women's wellbeing club and IT classes were all created and developed with key members of the community taking a lead role and supported with training where required. Volunteering became a key part of each project to ensure its sustainability and to ensure that where possible, Smartline left a community legacy. During COVID, face-to-face work became a thing of the past, so we worked on developing online communities, which was no easy task. Some community members required lots of support and encouragement and repeated training over many weeks in order to ensure that they could get online. What was at first a daunting and overwhelming experience for some soon became a very welcome door to the outside world and a much-needed social engagement tool. We met online in the face of Zoom coffee mornings. I've got a couple of colleagues there who supported that. We did online craft clubs with local businesses, and we did history sessions with Cres and Kerno, which is our historical archive service. Once COVID restrictions had lifted, we took those online communities and gave them opportunities to meet face-to-face through lunches, real-life trips out into the community, supporting them to get back to normal. It was a daunting prospect for many, but over time and with encouragement where needed, face-to-face community groups started to gain momentum again. Thank you. The guided conversation tool offered real insight and the ability to support at a practical level rather than through assumed need. It allowed us to plan and create meaningful projects that were person or community centred. The Smartline project used community work as a gateway to the exploration of digital technology, some examples of which you will hear from my colleagues later. With the right support, training, information and advice, individuals were successful in sustaining the projects that we developed. But how did all of this support our research around digital technology and health and well-being? Through our community work, we were able to build strong relationships that enabled us to broach the subject of digital technology in very informal ways. We were able to offer one-to-one sessions in IT support and group sessions, and over time we began to see that people were beginning to show an interest in taking part in our research alongside the community work that we were doing. As a result of this, we were able to engage the community in a variety of research projects, which you will hear much more about later. So what was our impact with this community work? Just a few quotes before I finish. So a community garden volunteer said, "This garden has meant that we were able to talk to our neighbours more and enjoy the space that we live in. I have met new people because of this." A museum volunteer said, "This project has allowed me to learn new skills to find out about my local area and to also support my volunteer role at the local museum. I'll be definitely coming back to Cres-and-Kerno more often." An online coffee morning participant said, "Thank you, Karen and Smartline, for doing this for us. I honestly don't know how I would have coped over the last few years without your support and the opportunities that you've given me." I know I'm on a timer, so I'm going to flick on. So what next? Although the project is coming to an end, we have various community groups well established with the necessary tools to carry on well into the future. We've various research papers published and in progress based on data and support from community members. More people are volunteering, more people are digitally included, and more people are socially connected. Most importantly, we move on knowing that we've made a positive impact on the lives of so many of our community members. Thank you very much.